Welcome back to You Heard It Here with Dr. Gary. I'm Gary, the clinical audiologist and part of the ownership team here with Advanced Hearing Group in Scottsdale, Arizona. Today, we're going to talk about the journey that is treating your hearing loss. That's right, treating your hearing loss is not as simple as buying a hearing aid, OTC, or prescription. There's a lot more to it. Stop thinking you can treat your hearing loss by buying a widget. I don't care what the advertisements say. I don't care what your friend said. There's a whole journey and a path that you need to take in order to treat your hearing loss as effectively as possible. The journey starts when you notice there's a problem. After you notice there's a problem, or more likely, your friends and family have told you there's a problem, you need to get your hearing tested. If you take a click on this link up here, you can see a whole video on what you should expect when having your hearing tested. After your hearing healthcare provider, even if it's not us here with Advanced Hearing Group, has ruled out any medical contraindications and approved that you are indeed a candidate for hearing aids, you should go through a trial period with those devices. Now, going through a trial period means that you're going to wear them. Yes, if you don't actually put them on your ears, you will never know if they're effective. It's not just wearing them though. This is the part where most people have the issue. People want to put hearing aids on and they want everything to be fixed. They want it to be like they heard 20 years ago. Unfortunately, the human brain does not work that way. If you have a hearing loss, especially if that hearing loss has been coming on slowly over time, it's going to take your brain time to acclimate. This is why the hearing healthcare journey is not just slapping on a hearing aid and hoping for the best. When you start this journey, you need to understand that there's going to be a little bit of back and forth. There are going to be things that you love immediately. There are also going to be things that you hate. That's okay. So the way that this journey works, it's kind of like this. Your hearing's evaluated. We determine what the best route for treatment is for you. By that I mean, are you actually a hearing aid candidate? Or are you someone who needs to go for a surgical consultation based off your hearing loss being conductive or mixed in nature? Are there other medical contraindications? If not, then we move on to the trial period. Hearing aids should not be set at a level that is uncomfortable for you. However, you are going to need to be pushed out of your comfort zone. Your hearing healthcare provider should be setting the hearing aids in a way that you're getting good benefit, but they're not overwhelming. You should wear them for a little while, a week, maybe a week and a half, and then you should return for further adjustments. These adjustments should be done in a way to get you to where you need to be, allowing your brain time to acclimate. Let's say you've come back for 2 or 3 visits and now you're at target or where you should be. And this has all been verified through best practice, real ear measures, or other methods of evaluating how well the hearing aid's working on your ears. That's still not the end of your journey. Your hearing, much like your vision, is going to change. As your hearing changes, changes need to be made to the prescription in those hearing devices. Unfortunately, this isn't something that you buy, put on your ears, and never think about again. The hearing aids are only part of the journey. Now, why are we embarking on this journey? Yes, to hear your wife or your husband or your children or the TV or your caregiver are all wonderful reasons to treat your hearing loss. But that's not the real reason. The real reason that we want people to treat their hearing loss is to help to prevent cognitive decline. Age-related cognitive decline, we want you to treat your sensory deprivations, both hearing and vision. We want you to stimulate your brain. That is not to say that wearing hearing aids or glasses will actually prevent age-related cognitive decline. It will not prevent Alzheimer's or dementia. But it's one more thing that we can do to stimulate the brain and work to keep good cognitive health as we get older. It's very important that you go through the entire journey. Don't stop partway through. If you've admitted there's a problem, follow the journey all the way through so you get the best outcomes with your devices. This has been You Heard It Here with Dr. Gary. Thank you for watching, and I'll be bringing more content real soon.